Hello everybody, and thank you for joining us. We will be going over Amber Black's evaluation report. Ariel was born on August 12th, 2010. She is 3 years old. She is in the first grade of the second month, and the dates of evaluation were November 11th of 2016. I was the examiner, and the name of the school that she goes to is South Hadley Elementary School. So Ariel was referred because her teacher, Mrs. Ellis, her first grade teacher, referred her to an IEP team. According to Mrs. Ellis, Ariel is below grade level in reading. Mrs. Ellis feels that Ariel is struggling with her reading fluency as well as decoding individual units of a word. According to recent evaluations, Ariel has not been able to finish a complete assessment in the allotted time. She states that Ariel spends a long time trying to pronounce the words. Recent assessment data shows that Ariel is at the benchmark or below grade level in reading. Previous interventions include Title I instruction with reading every day for 45 minutes. In Title I, they worked on segmentation, which is the breaking down of words into smaller units or syllables, and having Ariel reading aloud to the teacher. Ariel also wears glasses, lives with her father due to a recent divorce, and enjoys books about animals. Some assessment questions and why the evaluation was complete at the request of Ariel's IEP includes these questions. Number 1, what does the student not understand about reading? Number 2, what are Ariel's strengths and weaknesses? And number 3, how should instruction be modified? So some background about Ariel. She has been struggling with reading since kindergarten and has carried it with her into the first grade. In kindergarten, Ariel was taught basic reading skills such as phonemic awareness, vocabulary development, letter correlation, and more. By the end of the kindergarten year, Ariel had a difficult time differentiating between words that rhyme, decoding single word units, and her reading fluency was not strong. Ariel's first grade teacher has been having one-on-one time with her and having Ariel read to her. The teacher has observed that reading fluency is Ariel's strongest weakness. Ariel's results on words correct per minute assessment are below grade level or targeted benchmark. When reading aloud, Ariel is trying but has difficulty and grows frustrated, either because of her speed or accuracy. Ariel does not chunk words into meaningful units. These are some early observations that are the foundation of Ariel's referral. So some other, the test session observations of the test of word reading efficiency, which is the norm reference test, was tested in approximately 45 seconds, and Ariel was cooperative throughout the test. However, she took a while to sound out the words, and she was not able to complete the full test within the allotted time. Ariel was able to read smaller words with less hesitation, but spent a lot of time sounding out larger words. This test was completed in a quiet area, and Ariel did not seem to be distracted by anything around her. She focused as much as she could and deciphered each word to the best of her ability. With the criterion reference test, the phonemic segmentation test was conducted in one session for approximately 15 minutes. Ariel was instructed to say each individual phoneme, which is the individual sounds of each word. So I would instruct her to say cat, and she would have to separate it k, a, t to each individual sound. So she had a difficult time doing so for most of the words. This test was administered in a quiet environment. However, when Ariel struggled on a word, she would stare out the window. I had to redirect her attention to go on to the next word. Classroom observations. During classroom observations, Ariel appeared to take longer on reading assignments. Ariel was put into a group with a couple of her peers who were a mixed group of reading levels. Their task was to each read a sentence in their favorite book. While the other student read their sentence, Ariel was respectful and listened, and did not interrupt. When it was Ariel's turn to read her sentence, she struggled reading each word. She would try to sound out each word, and she was successful with smaller words like A or B, but if she couldn't figure out a more challenging word, she skipped it and kept on reading. One of the students in the group reread Ariel's sentence for her. During class instruction, Ariel is usually cooperative and followed teacher instruction. She appeared to be very friendly and very likable amongst her peers. So assessment methods include Ariel's academic achievement levels will be assessed with the norm reference test of word reading efficiency, subtest 1, which is sight word efficiency. The sight word efficiency test measures an individual's ability to pronounce printed words accurately and fluently. This was an acceptable assessment to conduct on Ariel due to the fact that she struggles with phonemic decoding. Ariel will also be assessed with a criterion referenced phonemic segmentation test. This test measures a child's ability to separately articulate the sound of a spoken word in order. This test was assessed due to the fact that Ariel had low scores on the test of word reading efficiency norm reference assessment. This will also guide our decision to decide specifically what reading deficiency Ariel has. So the test results for the word reading efficiency include, these are just some of the scores that are included in this test. So the standard score for this subtest and total scores, percentiles, as well as the age and grade equivalents. Standard scores have a mean of 100 and a standard deviation of 15. So the standard score, the standard deviation is a unit of measurement used to identify the distance of the score from the mean, and the percentile ranks are scored because it describes the percentage of age peers in the norm sample that obtained a score the same as, or lower than Ariel scores. And these are just the interpreted standard scores. So the results are as follows for the test of sight word efficiency subtest 1. So according to the manual, the findings were that Ariel performed below grade level for her age. She has a raw score of 61 words read per 45 seconds. She is in the 17th percentile for her age. Her sight word efficiency is at a 9 to 6 age equivalent with a grade equivalent rating of a 4.0. Further testing is needed for Ariel, and she has a strong these scores present a strong deficit in reading and needs additional instruction and practice for Ariel. So her raw score was 61. Her standard score was an 86. So it ranges between 82 and 90. And she has a 17% percentile. And with 68% confidence, we can say that she is in the 83 to 90% confidence interval. So for the testing for phonemic segmentation, scores are as followed now. So there wasn't much scoring that needed to be done for this. It was just based on her raw score, and she had to pass. She had to get 11 out of 22 correct, and Ariel scored a 9 out of 22 words sounded out correctly. So this test was given based on the norm reference test that Ariel needed extra instruction in phonemic decoding, So it was decided to test her with the phonemic segmentation criterion test. Ariel's raw score was a 9 out of 22, words read correctly, and this score suggests that Ariel lacks appropriate level of phonemic awareness. She struggles to orally segment prompted words into their individual units. These characteristics show that Ariel is not developmentally at the age level of her peers in word recognition. Therefore, she will need to be provided with considerable linguistic stimulation that focuses on the sound structure of English words in conjunction with her reading programs. So the conclusion of the assessment questions regarding this report include: what does the student not understand about reading? We found out that through testing that Ariel struggles with phonemic awareness and decoding word units. She can decipher some single and some double words effectively. However, she takes a while to pronounce longer words and their individual units. What are some strengths and weaknesses for Ariel? Ariel has a difficult time with her phonemic awareness and decoding individual word units. Ariel seems to be patient when trying to read. She does not get agitated if she can't figure out a word right away. Ariel enjoys reading books about animals, works well in groups, and enjoys hands-on activities. So how should instruction be modified for Ariel? We determined that Ariel should be given independent level text that she can practice again and again. The teacher can time Ariel and calculate words correct per minute regularly, and have Ariel chart her own progress. The teacher can change instruction to better aid in Ariel's reading. The teacher can also use phonemic activities for Ariel. Thank you, and I hope you have enjoyed.